Hi, I'm Dr. Castanet. I'm going to give you a little explanation about neck and back pain, actually probably a lengthy one, because I want to teach you about what causes neck and back pain, typically the common causes, meaning what causes it in about 98+% of cases. I'll leave out the unusual cases like infection, fracture, dislocations, tumors, cancer, that sort of thing. That's a very tiny subset of neck and back pain. The common neck and back pain comes from several entities that could broadly be described as degenerative in nature. These include things like disc bulges, disc herniations, facet arthropathy, stenosis. There's a subset of those that are instabilities, something called spondylolisthesis, which I've discussed on other videos. My objective in providing this explanation is so that you understand what causes neck and back pain, what's the most appropriate and effective way to treat it, when is it appropriate to do other things like strengthening, injections, surgery, that sort of thing. Just so that you understand my background and my perspective on all this, I have 33 years experience. I spent the first 18 years of my career in orthopedics, physical medicine, and physical therapy. I then went independent as a chiropractor, but I don't use conventional chiropractic most of the time. I don't find it very effective or appropriate most of the time. Instead, I use something called spinal decompression, which I'll explain at length later when I describe what causes neck and back pain. When I left orthopedics, physical medicine, and physical therapy after 18 years, I spent almost 4 years with a neurosurgeon learning surgical indications and procedures. So I do refer now to surgery when it's indicated in pain management. But I have an interesting and fairly uncommon perspective on all these things, because while I have spent time in those medical environs, including surgical practices, I've also spent time in non-surgical environments, treating patients, actually hands-on myself, as most non-surgical providers do. And it's the non-surgical providers that if they experiment with a variety of treatments, can really appreciate the relative merits of different treatments and the relative effectiveness of various treatments. And over the course of 33 years, having used all sorts of treatments that have come and gone and waxed and waned in popularity, and having a apparently rather unique perspective on what causes neck and back pain, which I'll explain to you in a second, and not wedded to any particular professional conventions about how I view neck and back pain causes. I've been able to independently choose and select what I think is the most effective treatment. And when I say the most effective treatment, which I'll describe in a minute, in the way of spinal decompression, I don't mean marginally better. I mean fundamentally very much better and more effective than conventional approaches by physical therapists and chiropractors. And the reason is that I have, I think, a simpler and more foundational and fundamentally sound conceptual approach to what causes neck and back pain. And that is very simple. It's not a mystery. So let me use a model to explain all of this. This is a model of the vertebrae or bones in the low back. If I turn it on end like this, this is the top of the spine, this is the bottom, this is from the side, this would be, your abdomen would be in front here, your back would be right here. In fact, these spinous processes are the little bony prominences you can feel if you run your fingers down the center midline of your back. So, we all have these spines, vertebrae, spines made up of vertebrae. In between the vertebrae there are discs. The discs, to simplify it, are made of two components. There are round annular fibers, they're tough fibrous connective tissue, that are kind of woven like baskets, and within that, those tough fibers is a central component. This particular model depicts the herniation of the inner component out in that direction. It's not supposed to be there. It's supposed to be more like this set of vertebrae. You can see in this model, it shows the beginning of the migration of the inner nucleus pulposus component of the disc out towards the periphery of these fibers. This is the direction in which herniations typically occur, and unfortunately that has to do with the anatomy and the demands and the direction in which we can move our spines. These outer fibers tend to wear out in the back part, and the nerves unfortunately are right behind the discs, so if the disc migrates all the way out there, it will at worst pinch a nerve, and that will cause pain in the distribution of that nerve, wherever that nerve runs. In the low back, the nerve runs down your buttock, thigh, leg, and foot. And in the neck, if this were neck vertebrae, the nerves run into your neck, shoulder blade, between the shoulder blades and down the arm. And the extent to which the pain radiates down the course of the nerve depends on and is proportional generally to the severity of the disc degeneration, bulge, or herniation. In any case, why does this happen? Well, we place lots of physical demands on our discs over the course of a lifetime. When we're young, we do abusive things to our spine, and because the inner fibers of this disc, the inner fibers here, are not innervated, they don't feel pain, we can start the degenerative process as kids and teens and not even be aware that this degeneration is occurring. So we can do all sorts of abusive things, jumping, landing on our butt, bending, twisting, all kinds of things that not so well tolerated in an older degenerated spine, and we don't learn that these things are abusive. Once the degeneration proceeds sufficiently to reach the outer fibers of the disc, which do have a pain innervation, then you begin to feel back pain. This back pain is often accompanied by muscle tightness, because as soon as there's a perceived threat by the spinal cord and the brain of injury and threat to a nerve root, it will cause a reflexive regional muscle contraction or guarding of the muscles in the area. So you'll very often feel tightness in the low back associated with some back pain. Sometimes the tightness of the muscles will be the predominant feeling you get, and this leads a lot of uninformed people, including even medical professionals that don't have much experience, to ascribe that muscle tightness or impute the muscle tightness as the cause of your back pain, as if it's a muscle strain. But muscles are very vascular, they heal quickly, they're not often strained. It's much more common to strain inert ligamentous structures like disc fibers. And so some of the early symptoms you get, and even if the problem is more severe, it's often accompanied by this muscle tightness. The muscle tightness will come and go as it needs to do its job. Its intended job is to splint the area, prevent it from moving, and mitigate the threat to the important structures like the nerve root, so that you don't move this injured area and it has a chance to heal. I don't treat muscle tightness. It would be futile to directly treat the muscle tightness. The way you want to treat the problem is address the underlying cause, and if you do that effectively, the muscle tightness dissipates on its own, and so secondarily, it will get better. But very often, for people, including professionals that are uninformed, they will direct treatments at the muscle tightness. It's pointless, it's a waste of time and money. If you treat the underlying cause, because you understand that the muscle guarding is a secondary phenomena, then you won't waste time and money, and you won't neglect to treat the underlying cause. In my view, and this is not a leap of faith, this comes from a real appreciable understanding about the natural history of spinal aging. And by that I mean the disc. The disc is where spinal aging degeneration starts, and as it proceeds and gets worse, it then involves joints, which will be made to bear more weight. When the disc degenerates, loses water content, and collapses, when the joint's made to bear more weight, it enlarges. We call that arthropathy. When the joints enlarge, they enlarge in every direction, including in the direction of the canal, so it makes the canal smaller. Associated with those degenerative changes of the disc and the joint are degenerative changes and enlargement of the ligaments here. The ligaments then enlarge and encroach on the canal as well. When this canal, the central canal, and I'll use another model to show you that. Here's another model, and this one will allow me to take it apart. The central canal is this canal. This is the canal where the nerve roots run. If you look at the side, let me put this back together. If you look at the side here, there's another hole. We don't call this the canal, we call this a foramen, but nerve roots exit the foramen on both sides of the spine at each level between each of the vertebrae. So we have this central canal where the nerve roots run up and down, and then they exit out the side there. If there's degeneration of the disc and the joints and the ligaments, and they all enlarge and encroach on this central canal or narrow the canal, we call it stenosis. And you'll see that term used as a descriptor on MRI reports. But stenosis is a little bit, needs a little explanation, because there are two ways in which we use that term. And remember, it just means narrowing. But the ways in which we use that term are, number one, to describe just narrowing at any place, whether it's the foramen here or the little recess here on the side of the central canal, or the central canal as a whole. So we can use it as a description just to mean narrowing of any of these regions, which is common as we age and degenerate. The other way, however, in which we use stenosis is to describe the clinical picture that you've seen in people in public. People with clinically significant stenosis are the people that you see bent over. They cannot stand up straight. This narrowing tends to be slowly progressive over the course of years and decades. If it gets bad enough, the person will become so narrow that they are limited and cannot stand up all the way. And in fact, they can't walk for a very long distance. They'll lean on a shopping cart when they walk. They will then try to sit down every several minutes, because what happens when you sit down with stenosis is it opens up the space a little bit. That provides them some relief. Then they can stand back up, which closes the canal a little bit. They can walk for a little further, several minutes perhaps. Then they have to sit down again, which opens the canal again. And they proceed like this, sitting intermittently in the course of their activities to get relief of this narrowing or stenosis. The treatment for that is surgical when it gets bad enough. Short of that, however, when it's not severe, you can simply open this up to create a little bit more space, and often that will suffice for many years, until and if it gets severe enough that it requires surgical treatment. I do not have a prejudice about any particular treatments, so long as they're effective. Sometimes non-surgical treatments are not appropriate. Sometimes, and most of the time they are, however, thankfully. Then the question is, what's the most effective non-surgical treatment to improve the patient and avoid surgical treatment if need be? Sometimes injections are appropriate. So there are lots of different discussions I've had on other videos about different topics, but I wanted to give you sort of a broad perspective about what causes neck and back pain. It's this slow, progressive, degenerative process that is interspersed with exacerbations of pain. As your spine degenerates, your threshold for provoking pain lowers, so it's easier to tweak your back or neck, either with a posture or an activity or an act, particularly if you don't know how to ideally do physical demands or how to assume postures that are better tolerated by your spine than others. I have videos on ergonomics where I discuss postures and activities and how to do them. I do need to make some videos on weight training because strengthening your spine makes some sense. And apart from that, strengthening is a great exercise to do for lots of reasons, metabolically and for functional reasons and physiologic and anatomical reasons. But that needs to be done in an appropriate way. There are lots of channels on YouTube with great instruction by other people on the topics. But with respect to this video, I wanted to provide you a simple explanation for what gives rise to neck and back pain. The best way to treat it is spinal decompression almost all the time. Spinal decompression, in spite of whatever was the proximate cause of your pain in the neck or back this time, addresses this underlying process that's lowering your threshold for pain and provoking your episodes of pain. So opening up the spine is the best way to provide relief to the disc, the joints, and the nerves. It works the fastest, it lasts the longest, and it provides you the best long-term approach to treatment. Physical therapists, because of their education and perspective, generally will recommend stretching and strengthening. Those are fine as adjuncts, but they're not really effective at addressing the cause of the pain, and hence they're not as effective at quickly resolving the pain complaint. For the longer term, you do want to have a strong spine because strength and muscles and splinting and protection by your muscles and strengthening of the ligaments, all of that serves your spine in the long term because it protects your spine from insults of physical demands of daily living. So if you bend, you lift, you sit, you squat, all those things are better tolerated by a stronger spine than they are by a weaker spine. I want to provide an analogy about the intrinsic strength of the spine and what makes strengthening valuable. And for that purpose, I usually use a rubber band to depict this with patients. So I'm going to use that for this purpose. Imagine that the inert, meaning the non-muscular components of your spine, the soft tissue components, not the bones or the muscles, but all the ligaments. And these are the things that give rise to pain typically, are ligamentous structures. These are inert, they're tough fibrous tissues, much tougher than this rubber band, but in some sense analogous to the rubber band because, like the rubber band, they can stretch, but they have tolerances. And the way they fail and give rise to pain is three ways. The way this rubber band might fail. I can make this rubber band fail, and I could likewise make a ligament fail by pulling it too far till it snaps, or pulling it a certain distance so it's under tension and holding it there for too long. This doesn't look like it's moving, and it's not grossly, but on a microscopic level, there's movement happening with the molecules of this rubber band. And you know that if I was to hold this here long enough, maybe it's an hour, maybe it's a day, maybe it's a week, eventually this rubber band would fail. So this is analogous maybe to sitting for too long. And of course, remember I told you earlier that your threshold for provoking pain is lowered when the tissues degenerate. So when you're 10 years old, maybe you can sit in a certain position for 3 hours, but maybe not when you're 60 years old. In any case, so that's the second way a rubber band can fail, or a ligament, to pull too far till it snaps, you hold it too long in a stretched position under load or tension for too long, or too many cycles of this over too short a time frame. Soft tissues are loaded, they need to be unloaded and relaxed. So you need to change positions frequently. Some positions are intrinsically more demanding of your soft tissues, like ligaments. So for example, bending over all the way is harder. You want to limit the extent to which you bend over. There are lots of little nuances, but I want to give you some basic principles about this. And I want you to appreciate the loads on your body when you're not grossly moving. Just because you're not grossly moving doesn't mean that the soft tissues are not under tension. And if you have a herniated disc or a bulging disc and you have back pain and it's provoked with sitting, then you know this to be true on a practical level. So, strengthening will improve your tolerances for these physical demands and postures, at least to a certain extent. But there's also problems with strengthening. There's probably only a couple of really effective ways to do that, in a satisfactory manner. I think the common exercises given for core strengthening, for example, are not very effective for people. That's another topic. But so now I've explained, I think, the cause of back and neck pain. This is true in more than 98% of the cases. I itemized at the beginning of this video the uncommon causes: cancer, fracture dislocation, infections, things like that. There's a subset of those non-malignant causes called instabilities that are another topic I've discussed on other videos. So let me get to the treatment I do, and it's spinal decompression. I've been doing this now for 13 years. It is by far much more effective than conventional treatment for the treatment of pain. It doesn't strengthen your back, but it gets you out of pain quicker. Then you can resume physical activities to strengthen your back, which are important in the long term. And in the short term, however, to get out of pain, you want to decompress the spine. That's the most effective way to address the immediate cause of the pain. It's also a good way to lengthen the useful lifespan of your spine, so to speak. It's always an appropriate means of treatment unless there's an instability that contraindicates it. Those are very uncommon. So that is my explanation. I hope that provides you some insight. I welcome you to watch many of the other videos I have on my YouTube channel. To get to the YouTube channel, you can go to my website, backstrong.net. You can click on the YouTube channel from there. I think the YouTube channel is Dr. Castanet, but I'm not certain of that. That's why I direct you to the website instead. I will do more of these videos. I hope you've appreciated this explanation. I think the most effective way to help people is to inform them as much as possible and direct them to the most effective treatment, and then encourage them to be fit and strong as possible thereafter. That serves not just their spine, but their overall anatomical and physiologic interests. So if I can help you, please call me, 404-558-4015. Thanks very much.